Well, today, welcome and to our medication administration demo. Today we have Joyce Brady, who has been admitted with a diagnosis of deep vein thrombosis to the right leg and hypertension. She has a history of glaucoma to the right eye and bilateral arthritis to both knees. Alright. So here's my master sign-in sheet. I already signed indicating I'm working with Miss Brady today. And then we'll just do compare our physician order to our MAR sheet, medication administration record. So first we'll just look at the name. We have Brady Joyce, date of birth 1954, 06, 28, which is the same FIN 663-999-452, the same doctor, so that's all good there. And then we'll just look at the medications we're getting prescribed today. So first we have warfarin 2 milligrams PO daily, and warfarin 2 milligrams PO daily, and that's for 8 o'clock. It's 8 o'clock this morning, so that's what we'll be administering. Next we have hydrochlorothiazide 25 milligrams PO daily, hydrochlorothiazide 25 milligrams PO daily. And then we have our Timolol 0.5% eye drops. We're gonna have 2 drops to the right eye BID. So let's check out, and we can just grab the medication out of the cabinet for that. So just to check, we have our warfarin here. So these are 1 milligram tabs. So today we're going to be administering 2 milligrams, Miss Joyce, so that'll be 2 tabs. Same name, birth date, and we have our expiry, which is next year, so that's good. And also just note now that Miss Brady has allergy to morphine, and none of her drugs today affect that. So just to double check the next one, we have hydrochlorothiazide. So we have that here, 25 milligrams. So only 2 tabs because these are 12.5 milligrams. That's for Miss Brady Joyce, same doctor. And expiry is not until next year, so that one's all right. And next we have Timolol, which is 0.5% solution, which is all right with these. And we have Brady Joyce, birthday, doctor, and the expiration on these eye drops are all right as well. All right, so before I handle these medications, I wash my hands and sanitize. All right, so start off with the warfarin. I'll just talk towards it a little bit. With warfarin, it interferes with blood clotting indirectly. It depresses hepatic synthesis of vitamin K, which is a coagulation factor. The reason for this drug is prophylaxis and treatment of venous thrombosis, as well as pulmonary embolism, atrial fibrillation with embolism, or it can be used in conjunction with prophylaxis of any systemic embolism following an MI. And then some adverse effects to look out for include dizziness, fatigue, lethargy, or any edema you should look out for, or any rashes to the skin. Contraindications with this medication include pregnancy, so the patient can be pregnant, or hypersensitivity to the drug, or any hepatic disease or failure, as well as any interactions with this medication. We'll expect, we'll just have to watch the INR results, as well as the increased risk of bleeding. And also noting that the patient is taking acetaminophen, so along with warfarin, that can affect the hepatic enzymes, so we just got to look out for the hepatic function with any signs of jaundice or anything like that. As well as we'll keep track of the patient's complete blood count, INR, prothrombin time, or just watch for any bleeding or skin irritations. All right, so today we have 2 milligrams. These are 1 milligram tabs. So we're gonna need 2 of these, 2 tabs there. And then immediately after, we'll just write up a tag for that. So we got the patient's name, warfarin, 2 milligrams, PO once daily at 0800 hours. All right. We got that tag made there. And then next we'll talk towards hydrochlorothiazide. So with hydrochlorothiazide, its action, it acts on the distal tubule and ascending limb of loop of Henle, and it excretes water, sodium, chloride, and potassium. And the reason for hydrochlorothiazide, it would be for edema, for treating any hypertension, diuresis, or hepatic cirrhosis, something like that. And then the dose for this, we have 25 to 100 milligrams per day, 1 to 3 doses with a max of 200 milligrams per day. That's well within our range today. As well as any adverse effects, we'll look out for drowsiness or depression, any blurred vision or fever, anything like that. Contraindications are hypersensitivities to any thiazide drugs, as well as if the patient's going through any renal decomposition or has any hepatic functions, so another hepatic to look out for with jaundice with that, as well as any interactions with dioxide, increase the risk, and also an increased risk of hypokalemia with corticosteroids or tesilorin or salbutamol. And we'll just with this drug, we got to watch for the input and output as well as BP, and we'll just keep track of the complete blood count again for that. Okay. So hydrochlorothiazide, we have 12.5 milligrams, so we need 2 tabs to make our 25 milligram dose. Here's our 2 tabs. And let's make a tag for that immediately after. So we got Brady, Joyce Brady, hydrochlorothiazide, 25 milligrams, PO once daily at 0800 hours. Check that one. And I'll just talk back towards warfarin. With the dose, we just want to double check the dose and make sure it's in. And we're well within, we only have 1 milligram, and that's way under the daily dose. So next and lastly, we'll talk to timolol, which is 0.5%. And it decreases the aqueous humor and increases the outflows. It's treatment. The reason for this drug is to treat glaucoma or any ocular hypertension, as well as any adverse effects will be anxiety, depression, headaches, or any changes in vision, as well as the dose mentioned on this one. So we have 1 drop per eye with the 0.25 solution, but with the 0.5 solution we can have 1 per eye if there's no response. So that's all right with this solution. With 2 drops we're okay with 1 eye, as well as any contraindications include any hypersensitivity to the product or any other beta blockers, as well as asthma or COPD. And any interactions, like I said, increases beta blocking, and also you got to watch the internal ocular pressure, make sure it's reduced, indicating a therapeutic response, and watch for any signs of increased BP or just watch for the anti-hypertensive effect. So we'll just keep track of that therapeutic response and monitor the internal ocular pressure for that. And with the eye drops, we're going to need cotton pads for the excess, as well as gloves and water for the medication. All right. So now that we got that, I'll just double check before we go into the room. Cross-reference the MAR and the tag to the medication. So just to make sure, we have Joyce Brady, warfarin 2 milligrams, PO, once daily at 0800 hours, so that's all right. And for hydrochlorothiazide, so Joyce Brady, hydrochlorothiazide, 25 milligrams, PO, once daily, 0800 hours. All right. And Joyce Brady, same date, 2 drops, the right eye, BIV, and that's all good. I'll just initial these, indicating that I got them ready and confirm they're ready before we head into the room. All right. Okay, and before we don't want to leave these medications unattended, so we would put them back into storage before going to the patient's room. It's coming out. Hello, Miss Brady. How are you doing today? Good? Alright. We're just going to come to, my name's Morgan. I'm a second year nursing student with the U of M, and we're just going to administer 3 medications this morning at 8 o'clock for your 8 o'clock time. Can you just get me to, alright, can you say your name to me? Brady Joyce, okay. And do you know of any allergies that you have to morphine? Okay, that checks out with our documents here. I'll just double check your tag. So Brady Joyce. And then allergy to morphine. Same fin. Okay, same doctor. All right, so now that I know the room's secure when I came in and we did our checks, the patient seems like their level of conscious is all right. So now I can just ask them, can I raise your bed to administer the medications? Okay, thanks. All right, let's get to a high Fowler's position here. And I'll wash my hands before I administer or handle any medication to the patient. All right, Miss Brady. So today, we've got 3 medications. One will be warfarin. So your warfarin today, was prescribed for your deep vein thrombosis as well as your hypertension. And so any adverse effects to look out for just include dizziness, fatigue, lethargy, or any chest pain or edema that you want to let us know about, anything like that. As well as we'll just keep track of your blood record, your blood count, as well as your INR and prothrombin time, and we'll just keep track of any bleeding or fever like that. So that's for your warfarin. Next we'll talk towards the hydrochlorothiazide. So with your hydrochlorothiazide, today that's prescribed for your glaucoma and your arthritis to your knees. So yeah, hydrochlorothiazide for your edema, hypertension, as well as any adverse effects to look out for include drowsiness, depression, headache, fever, or any blurred vision. And we'll just look for, watch your input and output, your urine, make sure everything's acting all right, and we'll watch your BP, as well as your blood glucose, uric acid, and electrolyte balances. And next we have Timolol. So this is it's for your glaucoma. It'll help relieve hypertension in your eye. And we'll just be administering 2 drops to your right eye today. And any adverse effects to look out for include depression, headaches, nightmare, and any changes of vision you want to let us know about. And we'll just evaluate the therapeutic response and monitor your internal ocular pressure. All right. So those are the drugs, and we'll just reference those to make sure. We got Brady Joyce, warfarin, 2 milligrams PO, once daily at 0800 hours. Warfarin, 2 milligrams PO daily, 800 hours. All right, and I have to confirm this is the patient, so we know that's her. And then we have the hydrochlorothiazide, so Brady Joyce, 25 milligrams PO, once daily at 0800 hours. So we got that, and we cross-reference with the patient. And Tomolol, 0.5%. We got 2 drops to the right eye, BID, and that's for Brady Joyce, and that's all good there. All right. So, to administer the medication, you just give it to the patient if they want to take it or if they need assistance. And Miss Brady would like a cup of water, so we could assist her with that. She gets a cup of water. And so after that, you just want to make sure that the patient has in fact swallowed the medication, they're not choking on it or holding it in their mouth, anything like that. And next we'll have the next we'll administer the eye drops. I'll just lower the position of the bed before I put on my gloves. Let's get Brady almost flat there. All right. Let's put on my gloves. All right. So I got my eye drops here, and I got my cotton swabs. So let's come over to the patient's right side. So we're going to the right eye, and so with the eye drops, I'd get them ready, and you just hold the patient, hold below the eye, open it up, and add it not directly to the eye, but in the just below. And then this will be for excess fluid, and you just want to hold the bridge of the nose so there's no drainage into the lacrimal duct back into the systemic system or into the person's system through their nasal. You just want to hold it for 30 seconds to a minute, depending if there's a lot of extra fluid or not, before you administer the next drop, and then you could administer the next drop and repeat the process again, another 30 seconds to a minute. And after that, just want to confirm with the patient they're all right, they're feeling okay, get them back up to a comfortable position, to a high Fowler's position that they were sitting at. All right, that's good, okay. And so that's all your medication today, Miss Brady. I'm just gonna sign that I did administer this medication. I'll just initial for warfarin, hydrochlorothiazide, as well as Tomolol. Okay, so got those 3 there. Those are checked out. And just before leaving the room, you want to make sure the call bell's within reach. All right, there you go. Here's your call bell, Miss Brady. If you have any of those adverse effects that I talked about or any other effects that seem abnormal, just feel free to pull it and we'll come check on you right away. All right. Thank you for that. I'll be back later. Okay. Thanks. See you.